Hi, everyone. My name is Andrew Klein, and I'm an assistant professor of medicine and clinician educator at the University of Pittsburgh School of Medicine and UPMC Health System. I am very excited today to have the opportunity to present our research on behalf of this amazing group at UPMC. The title of our abstract is Follow the Leader, Association between Leader Effectiveness, Leader Rank, and Physician Well-Being. Before we begin, we have no disclosures or conflict of interest to report. Now, as many of you know, effective leadership has been associated with decreased physician burnout and increased physician satisfaction. In the off-cited study by Dr. Shanafel et al., involving over 2,800 of their physicians at the Mayo Clinic in the United States, they found that for every 1-point increase in overall leadership score for a given leader on a 12-item leadership quality survey, there was a 3% decrease in the likelihood of burnout among their employees. This, in addition to our own observations, led us to ask how much is this inverse association between leadership and burnout due to the X factor of charismatic individual leaders versus how much is it due to the measurable and intervenable leadership skills measured on the Leadership Quality Survey. To answer this question, we distributed the Physician Wellness Academic Consortium survey to the 7,385 attending physicians within the multi-hospital UPMC health system in the fall of 2018. Participants were asked at the outset to identify the rank of the leader they viewed as their immediate supervisor. This could include their training program director, medical director, section chief, division chief, department chair, or dean. The survey included a 9-item leadership quality scale. This leadership quality scale with the items shown here was derived from the Shanafel et al. Study that I cited earlier and asked physicians to rate the leadership qualities of their immediate supervisor in these 9 dimensions on a scale of 0 to 4, from strongly disagree to strongly agree. These items were designed to assess specific characteristics of leadership that are measurable, actionable, and learnable. An overall leadership quality score was calculated at the end by taking the average of the 9 items, again with a minimum score of 0 and a maximum score of 4. The Physician Wellness Academic Consortium survey also included a 10-item burnout and 6-item professional fulfillment measure, both from the validated Stanford Professional Fulfillment Index, and each scored using an average of a Likert scale ranging from 0 to 4. Our primary outcome was the association between leader quality score and physician burnout when controlling for the random effects of our clusters that approximated each individual leader and adjusting for age, gender, race, and specialty. To create clusters that approximate individual leaders, we clustered participants' anonymous survey results by their rank of their immediate supervisor, department, division, and specialty. Secondary outcomes included the association between leadership quality score and professional fulfillment and the individual components or items on the leadership quality score and burnout and professional fulfillment, with each analysis adjusted for the same covariates. We then performed clustered correlation analyses between leadership quality score and burnout and leadership quality score and professional fulfillment, running each model once with the overall leadership quality score and once with the individual items on the leadership quality scale. Now for our results. 3,112 of our 7,385 attending physicians participated, roughly 42%. A quarter of participants were less than the age of 40, 26% between the ages of 40 and 49, 23% between 50 and 59, and nearly a fifth of our respondents were above the age of 60. 57% identified as male, and 71% identified as white. 47% of participants practice in adult medicine or a medical subspecialty, 20% within surgery or surgical subspecialties, and 12% within pediatrics, with less representation among our other specialties. The largest group of participants, 37%, identified their division or section chief as the leader they chose to evaluate, and this was as expected. To give you a quick overview of our descriptive statistics, the mean leadership quality scale score was 2.58 with a 1-point standard deviation. A reminder that the leadership quality score ranges from 0 to 4. Our mean 10-item burnout measure was 1.24, with a lower score indicating less burnout. For reference, a burnout score on this measure above 1.33 is the dichotomous cutoff for burnout being present. The mean professional fulfillment among our participants was 2.52, with a higher score on this measure meaning more fulfillment, and with a score of 3 being the dichotomous cutoff indicating that fulfillment is present. Bringing this together visually, here we have the unadjusted plots of the average leadership quality scores of each cluster on the x-axis, plotted against the average burnout and professional fulfillment scores on the y-axis. You can see a clear trend of decreasing burnout and increasing professional fulfillment with higher leadership quality scores. And this association is proven significant when plugged into our final adjusted model. We found that leadership quality score was significantly associated with both burnout and professional fulfillment, with better leadership leading to less burnout and more fulfillment. This is consistent with the prior findings that I mentioned earlier. And in fact, each one level increase in leadership quality score was associated with an 8% decrease in burnout and a 10% increase in professional fulfillment score. When looking at the intra-class correlation coefficients, we find that they are significant, both for burnout and professional fulfillment. This was true both in the model including our overall leadership quality score, shown here, and our model including the individual items of the leadership quality scale. You can see the likelihood ratio test p-values for the overall leadership quality score listed here, each well below 0.05. However, the intra-class correlation coefficients are small, ranging from 0.028 to 0.057, suggesting that they explain very little of the variability within our model. This suggests that while significant, the effect of individual leaders, as approximated by our clusters, on burnout and fulfillment is overall small, and particularly when we control for the dimensions of the leadership quality scale. And this has a potentially empowering implication that we will unpack more later. But the effect of leadership on burnout and fulfillment depended more on learnable and actionable skills captured by the overall leadership quality scale than it did on any one leader's individual character traits, style, or X factor not captured on that scale. When we looked at the model with the individual items on the leadership quality scale included, we find that 3 of the items are more strongly and significantly associated with less burnout, including empowers me to do my job, keeps me informed about changes taking place, and overall satisfaction. This highlights the importance of supportive and transparent leadership and communication skills in preventing burnout. Similarly, we find the same 3 items are more strongly and significantly associated with increased professional fulfillment, including empowers me to do my job, keeps me informed about changes, and overall satisfaction. In addition, and in contrast to burnout, however, recognition for a job well done and encouragement to develop talents and skills were more important and significant for professional fulfillment. This finding again emphasizes the importance of supportive and transparent leadership, but also highlights the importance of encouraging mastery and appreciation to professional fulfillment. Our study has several limitations. Due to the anonymous nature of our survey necessitating that we approximate individual leaders by clustering by rank, division, and specialty, we cannot be certain each cluster refers to an individual unique leader. Some clusters may pertain to multiple different leaders, and multiple different clusters may refer to the same leader. Participation rate was 42%, which always makes you wonder about the missing 58% of physicians and raises concern for sampling bias and response bias. Finally, there is the pandemic factor. Our data predates the current global pandemic, and while we have good reason to think that leadership has only become more important in the past year, our data is not able to comment on this. In conclusion, Within the limitations of our study, the individual leader, as approximated through our clustering, while significant, explained very little of the variability in the association between leadership quality and burnout. At the same time, leadership quality score was significantly associated with both burnout and fulfillment, with each one-level increase in leadership quality score associated with an 8% decrease in burnout and 10% increase in professional fulfillment. Empowering and transparent leadership skills appear important to both burnout and professional fulfillment, while recognition and fostering of skills and talents were also significant for fulfillment. Taken together, we think these conclusions have an empowering implication. They suggest that leadership can be trained, because regardless of who the leader is, what is more important is whether they exhibit these learnable skills, making their physicians feel empowered, informed, recognized, and supported. Future research looking at the effectiveness of leadership development with an emphasis on these skills will be essential. Here you'll find the citations for our references, largely the sentinel work of Dr. Schoenfeld and Dr. Schrokel. Thank you so much for listening and the opportunity to share our work. We very much look forward to talking more in the question and answer session. Thank you.